Wegovy is therapeutic for obesity because it reduces cravings and reduces hunger, which is a nice way of saying you feel really sick to your stomach and you feel nauseated, because that's what happens. These drugs have been shown to sometimes lethally inhibit the intestine's ability to move food. There's a process called peristalsis in the guts. It's the process whereby we swallow food, spends a little time in the stomach, and then it starts being squished down the intestinal tract, ultimately making its way out of the rectum. But semaglutide basically stops that process. And in some people, becomes lethal, where they have food that is sitting in their stomach for days at a time. This has become so known now that if someone who's on Wegovy is going in for a surgery, they'll typically tell a person to fast for 24 hours before the surgery to reduce the risk of them vomiting up food and then breathing it into their lungs and causing a sort of pneumonia and potentially killing themselves. But they find that in people who are on this drug, even though they're telling them to fast for a day, they still have a stomach full of food, because all the food they're eating is just staying in the stomach. It's not moving through the intestines like it's supposed to. So that, of course, can become very, very lethal. And then the effect on the fat cell, very, very briefly.
We'll do another episode fully on fat cells, okay?
In fact, we will need to, because that's such a big topic. Yeah. I'll just say that it also changes fat cell physiology. The fat cell is sort of the part of this conversation that I could have invoked at multiple instances, but haven't, because it just sucks all the oxygen out of the room. So there are also changes at fat cells that worry me, that if a person ever decides to get off the drug because they either can't afford it or they're tired of feeling sick, then there's going to be a significant rebound in weight gain because of this multiplication of fat, albeit very small fat cells that are shrinking. But once they start eating again, presumably eating the way they used to, now they have literally more fat cells than they did before they started. So their potential to gain weight is higher than it was before they ever started the drug.
Yeah. So this is a little geeky, but does the inhibition of glucagon through these GLP-1 agonists like Ozempic, does that inhibit one from going into ketosis? Because as I understand, glucagon is also responsible for telling the liver to release some glycogen and also engage in some gluconeogenesis to create some glucose, but also can signal this process of lipolysis, the breakdown of triglycerides into fatty acids and ketones. And so essentially, if you're inhibiting glucagon, do you essentially always keep the body out of ketosis? And might that be one of the side implications of Ozempic, do you think?
Yeah, good. That's a very good question. So that question has not directly been answered. Actually, looking at the degree to which semaglutide, the drug itself, the molecule itself, inhibits or activates ketogenesis, that is unknown. The direct effect that you're invoking is worth mentioning, which is namely, glucagon is implicated in being a necessary player in activating ketogenesis. I say implicated because the data are actually kind of conflicting to show whether it is essential or not. I would say that I doubt GLP-1 agonists are going to overall inhibit ketogenesis, only because even if glucagon provides some kind of stimulatory signal, the inhibitory effect that insulin has on ketogenesis is way bigger than any stimulatory effect that glucagon may elicit. So insulin's inhibition is way stronger than glucagon's activation.